Today's Toolbox Talk is on bloodborne pathogens and how it relates to you. Before we get into that, it's important that you take time to sign in, print your name, sign next to your printed name, the attendance record. And then once everyone has signed that, please make sure that the general manager or somebody in leadership emails me the attendance record no later than Friday to jason.myers@steprises.com. So today we're going to have a couple of goals here. What our learning objectives are is who is at risk for bloodborne pathogens? What are the sources of contamination? How does it get transmitted from one person to another? What can we do to control it? And what can we do? What are the steps to follow in the event that there is an exposure? So what we need to understand is the definition of bloodborne pathogens, who is at risk, who's covered by OSHA's bloodborne pathogen standard, the types of bloodborne pathogens, and here we go. Bloodborne pathogens can be defined as disease-causing microorganisms in blood, bodily fluids, and tissues that can cause serious diseases in people. This is part of our annual refresher training for the Stepaway family of businesses. Some of the examples of bodily fluids and diseases that cause these types of contaminations: malaria, syphilis, hepatitis B, HIV. OSHA's bloodborne pathogen standard simply says that occupational exposure means that the employee could be reasonably anticipated to come into bodily contact with blood and other potentially infectious materials. Bloodborne pathogens does not cover those who are engaged in Good Samaritan acts, so outside of the work platform. You want to help somebody, this training will still apply to you and keep you safe, not only out there performing Good Samaritan acts, but here at work as well. People that are at risk, here's a list of people, but what you need to know is that you too are at risk for these. Considering the work environment that we're involved with, the customer base and their challenges, it's important to understand that you too are at risk for these types of bloodborne pathogens. So sit up straight, pay attention, take some notes, and apply this to your job in the field. You as a service technician, you as a drain technician, sorry, double speak there. You as an excavator, restoration employee, we are all exposed to these types of potential challenges. Hepatitis B specifically, it attacks the liver. It can cause a fever, give you jaundice, that's that yellow coloring of your skin. It can cause some nausea, some vomiting. It can lead to cirrhosis of the liver. It can lead to cancer. Hepatitis B, as of right now, to the best of my knowledge, does not have a cure. Hepatitis C, the symptoms are very similar to hepatitis B. About a 1/4% of those infected with hepatitis C will recover all on their own. But unlike HBV, you can become reinfected. 3/4 of the people that are remaining, this kind of thing, hepatitis C, leads to a chronic infection, liver disease, and it may be life-threatening. HIV attacks the immune system, and there's all kinds of HIV diseases out there. It's an acquired immune deficiency syndrome, is the long name for it. The symptoms for HIV can vary, but oftentimes it causes weakness, fever, sore throats, and a white coating of the tongue, and a few other things. So number 2, how does bloodborne pathogens get transmitted? How does it go from one person to another? It's specifically fluid, bodily fluid. tissue are the main pathogen sources. Some of the common routes of entry, um, infected blood, other types of bodily fluids and solids, amniotic fluid. Here's a list of some of the other ones, but typically we're dealing with sewer systems, septic systems, those types of things. So we want you to pay attention and to be on guard to protect yourself while you're serving our customers. Point number three, there is an exposure control plan. How can you eliminate or dramatically reduce your risk to this types of exposure? One of those elements to the control plan is this training here today. Taking the time to observe the material that's being shared, ingesting that, understanding it, and putting those gloves on, utilizing your personal protective equipment to keep you safe while you're working. As it relates to training, this particular module, it's important that is completed upon a new employee coming to work for us, an annual refresher, or when we're going to change the procedures and our controls for trying to keep you safe. It's important that if you have any types of cuts, lacerations, that you're going to try to cover those yourself for a variety of different methods out there: bandage, gauze, adaptic, different kinds of tapes to hold those bandages in place. It's important to understand that when there is the potential of infection, that you don't touch your face, you don't touch your mouth. Be careful of what you're eating, drinking, putting on cosmetics. These universal precautions is the nitrile gloves that we provide. It's the safety glasses, the safety goggles. You want to treat all the material that you're working with as if it's contaminated. You want to be on guard at all times and don't let casualness develop into the way that you approach this particular topic. Sharps, depending on where we're working, there's quite a few diabetic patients out there that are our customers. They could have sharps lying around. Sharps are used needles that they haven't put into their sharps container, providing you with an exposure possibility. If you get stuck by one of those, we definitely need to know. Decontamination is really important. Let's say you get a laceration working on a tool, that type of thing, and your body begins to clean itself by bleeding. It's important that you control that bleeding. We want to help you with that. Always apply direct pressure, apply cold application, and elevate that injury above your heart if possible. Those three ways are the best ways. When I was in the fire service, we typically would do all three at the same time, and just about always we were able to control the bleeding. Once the bleeding is stopped and you have separated yourself from additional contamination sources or contaminating other people, we want to clean up that mess. We can typically use a 1% bleach solution, 1% bleach, 99% water. We could utilize vinegar opportunity, the organic, the higher concentration, for 30%, I think is what it is. So before we make any of that, let's talk together to make sure we're all making great decisions. But when you're cleaning up, it's important to cordon this off, put on the PPE that's required, place any type of absorbent mat or pad on that spill, pour that disinfectant on that particular area, collect everything up, dry it, put it in a garbage bag that doesn't have any types of holes, and we'll dispose of that material in a biohazard bag. Hand washing is so important. It's one of the most important practices that you can do, even at this particular job. You don't have to be a first responder, medical provider. Washing your hands is a great way to help on your defensive strategy for avoiding sickness. Typically, washing your hands for 30 seconds, mild soap, water, the combination. It doesn't have to be hot. It's definitely better that it would be warmer water. Washing it for 30 seconds, rinsing it off, making sure you get all the crevices, your knuckles, all the joints, all the different areas on your hand, being very thorough for that. The what I call it, the hand sanitizer is a okay last resort, but all it does is just cover the surface. It doesn't get the germs out of your pores, out of your crevices, out of the cracks there. Personal protective equipment, to use it, how to take it off. I have a video here in just a second to show you how to do that. You want to make sure that your gloves fit you, that they're not too loose, that they're not too tight. You can measure around the palm of your hand. When we get into our PPE segment, I'll show you how to do that. Follow those universal precautions. After everything is said and done and you take those gloves off, wash your hands appropriately. Here, I'm going to show you how to take your gloves off the safest way possible.
Called glove germ, which fluoresces under UV light, show improper glove removal.
Did you notice where our fingers touched? Now you do.
In this demonstration, we'll once
Pay
again
attention
use
to
glove
this
germ
section.
to show the importance of proper glove removal. First, using a gloved hand, pinch and hold the outside of the glove near the wrist. Peel the glove downward, away from the wrist, toward the fingers, turning the glove inside out. Hold the removed glove in the gloved hand. Slide fingers of ungloved hand under the wrist of the remaining glove and peel downward toward the fingers, turning the glove inside out over the first glove. Discard in an infectious waste container.
There you go. Just as easy as that. It's important to understand also that as it relates to responding to an incident, paperwork, and follow-up, it's important to understand that if the infection, we covered the hands, but it gets into the eyes, the nose, the mouth, you want to be able to flush that out as soon as possible. You want to be able to report that to your leadership and consider getting a medical evaluation. Blood testing could be risk counseling, post-exposure protective treatment. There's some varieties depending on what we have here. Too many to list for such a short period of time of that. And a great follow-up. So in summary, always understand what hazards you're working with. Use your proper protective equipment. Report any type of exposure immediately to your general manager, branch manager. Don't handle broken glass. Don't handle sharps. Those are the needles with your hand. Make sure that once everything is cleaned up, that we're disposing of those things properly. If you have a question about this particular training or have a suggestion on a future training, don't hesitate to reach out to us. You can reach me by email at jason.myers@steprises.com, or feel free to reach out to me on my phone at 330-488-4141. Be safe out there.